Okay, I think we'll make a start if everyone's agreeable. Very good morning to you. Welcome to this Wellbeing webinar, which has been co-hosted by Howden and Hargreaves Lansdown. My name is Ian Foster, and I'm going to be your chair for this morning. I very much hope that this event will raise lots of questions. If you do wish to put a question to the panelists, if you can use the Q&A tab, which will pop up at the bottom of your screen rather than the chat tab, and we'll do everything we can to answer any questions that arise in the session. But if we do run out of time, we'll of course follow up afterwards, and I think we'll be doing that anyway. So don't worry if you have a very pressing question, we will be able to pick that up. So looking at both Howden and HL, both organisations are working together to bring better outcomes in the area of well-being, recognising this is a really wide-ranging issue and no one party can have all the answers or all the solutions. But both businesses do have significant numbers of asset managers like yourselves as clients, so we believe that we're really well placed in our understanding of your sector. So it falls to me to thank you very much for your participation. Hopefully it will be an active participation. I think you'll be rewarded not only with insight into some of the issues regarding well-being, but whether they be mental, physical or financial, but also you'll come away with a really useful how-to plan. Both presenters will break down well-being into easy to understand components, so we're all listening and understanding using a common language, which I think is a really important thing to establish. Both organisations, Howden represented by Robbie Weston and Hargreaves Lansdown represented by Richard Turner, will share recently collated data that will illuminate the gap, which can often be really wide, between having a really high benefit package, but perhaps that package is not sort of consolidated in a strategic structure. And we want to help you to manage these solutions better to deliver ultimately better well-being. In short, our objective is to highlight the gap, signpost the solutions, and help you take the first steps towards improved outcomes for both your employees and, importantly, for you as a sponsor. I mentioned that we'll be sharing hard evidence earlier. Howden has just published a fascinating wellbeing survey specifically for the asset management industry, and a copy of which will be available after the meeting. So if we can make a start, I'm delighted to introduce Robbie Weston from Howden as our first speaker. Morning, Robbie.
Good morning. Thank you, Ian.
Are you muted, Robbie? Oh, sorry, it was just on a bit of a lag. Thank you. So, Robbie, if I can kick off your section of the presentation. As I mentioned earlier, you recently surveyed the asset management sector to understand buying habits and concerns. Can you summarise your findings for us?
Yeah, with pleasure. And yeah, thank you for inviting me to speak today. So we surveyed 160 asset management firms, and we specifically targeted the headcount of under 350 to ensure that we understood the benefits being offered by this sector, but also specifically not the really big headcount players in the sector. And firstly, we had confirmation of the really high quality of benefits that are offered amongst these clients. Almost every company took out private medical insurance and a very high quality of private medical insurance. In the statistics, we got to 99%. I know the company who answered not that they didn't have it, and they do now. So you can assume that everyone in this sector has a really good quality private medical insurance policy. Death in service 88% and primarily at 4 times salary. And then group income protection at 73%. And again, it's a comprehensive policy, usually 75% protected. Companies also reported a really good range of non-insured benefits, things like cycle to work, season ticket loans, gym discounts, health assessments being very popular. But the thing that was really interesting for me about the research was that only 12% of respondents had a formal strategy in place. And that would be well below the benchmark of the CIPD would expect at 44%. And also very interesting is that 35% of those surveyed were expecting to put one in place in the next 12 months. And that indicated to me a really clear message, which was that companies recognized that well-being was important, but in many cases, we think they needed help to formally consider and articulate what it would mean for their company. And specifically within the well-being questions, the mental health issue was highlighted as being of particular concern. And the survey was done during lockdown, and I've had multiple conversations with many clients ever since, and certainly that continues to be the major concern as we have exited lockdown and move into the next stage.
Thank you, Robbie. So if there's an acknowledgement that well-being is hugely important, it's certainly a key takeaway from the survey. Can you explain what the value of well-being actually is and why it's important to employers, and in particular to asset managers?
Yeah, absolutely. So when we talk about the value of well-being, it's sort of quite a generic term that gets thrown around quite a lot, but you can look at it from two perspectives. From the employee perspective, it's designed to prevent the deterioration of health, mentally or physically, and maintain good health. But also from the employer perspective, it's really about improving your output or the output of your employees, and therefore there is a return of investment in having a good well-being strategy, alongside the very real moral obligation that most companies recognize to look after their staff. And companies are more receptive than ever to the positive impact of well-being because of that potential improvement of performance, and therefore the employers are interested in investing in ways in which they can just gently nudge employees to be slightly more efficient and slightly happier, and that they recognize more than ever that makes them better employees and better contributors to the business. And also the employees themselves are more conscious than ever of the role they want their employer to play in supporting them. I think previously it would be the case where employees wouldn't necessarily look to the employer to actually support them in some of these areas, whereas partly because of COVID and partly because of the demographic of younger workers, employees are looking far more proactively towards their employer to support them. I want to give you a tangible example. So if you can imagine an employee who's struggling with sleep patterns due to anxiety, they'll be a far less productive employee than if they were well rested. If you can think about a very hungover employee turning up to work compared to one who's well rested, and consider which one's going to make better business decisions, interact better with colleagues, represent your business in a way that you want. If the business could help their staff with something like sleep, not only helps the employee avoid deeper problems, which is very much what well-being is looking to achieve, but it also improves their effectiveness in their role, therefore this dual benefit that I talked about earlier. An effective well-being strategies, whether mental, physical, or financial, just are there to give people small nudges to make positive differences to their lifestyle and health, which the overall effect of which should be a more positive outcome. So in short, effective well-being has two outcomes really. Firstly, help a valued member of staff remain well or become healthier. And secondly, it aims to increase productivity by having a healthier and happier workforce who ultimately will be better at their jobs.
Thanks, Robbie. So we're hearing a lot about a well-being strategy, packaging all these things together and driving in a particular direction. And your survey certainly highlights this as being on the agenda of roughly a third of asset managers. Can you explain why asset managers should develop an actual strategy as opposed to just potentially providing a series of product solutions?
Yeah, absolutely. And I think that's critical to the work that we're doing at the moment. So employee benefits policies offer various types of protection and services, and they're designed to support the staff, the member of staff. And we know already that most asset managers will buy the medical insurance, death in service, income protection, and have a good pension. And these are, of course, the bedrock of any wellbeing strategy. But the wellbeing strategy really needs to be the overarching umbrella that informs what policies are bought. And interestingly, what elements of those policies are given the most focus. And it should be the strategy to enter the values of the business, or to ensure the values of the business are reflected in the benefits and wider services offered, and the communication of those benefits. So in reality and in practice, the reason the employer usually buys these policies is to treat people as opposed to prevent them getting ill in the first place. But the providers over the last few years in particular have really developed their products to include a significant number of additional resources, primarily around well-being. And that well-being strategy should capture those additional elements in a coherent way. So the strategy really should consider if the benefits are being used or presented in staff in a way that maximize their value. We talk here about pathways. Can a staff member see a clear pathway from problem to solution? And importantly, help prevent problems arriving in the first place? And are these additional features being promoted in a way that helps the staff know when to use them? In fact, your wellbeing strategy could be quite simple. We want to offer sector-leading employee benefits and ensure we present our benefits in a clear and coherent way to maximize their impact. And to be honest, that sounds like a pretty good place to start with wellbeing. Most asset managers already have the benefits in place. It is the framework, the focus, and the communications that's often lacking. When you're looking at the strategy, you shouldn't forget the interrelationship between the benefits. So for example, as Richard's going to talk about a bit later, if the financial well-being is forgotten and you have staff who are seriously worried by money issues, they're far more likely to suffer from other mental health issues as they feel anxious about their money. And conversely, if they feel in control of their money, they may be better able to deal with the other things that life throws at them. So I'm happy to explain a practical solution as that we use, because I think we all recognize that well-being can be thrown around as a generic term, and many of us will have sat in well-being seminars and left without understanding what a solution could actually look like. So within asset management, we're typically dealing with sophisticated buyers, although they tend to have relatively small HR teams as their company headcount is fairly low. So we recognize that really complex wellbeing strategy is unlikely to work in this market because it really requires more resource than companies have in their HR team. We therefore designed a process where we firstly consider the health of the staff and then align their benefits to staff health rather than explain what the policies you buy are and then let the member of staff establish when to use those benefits. So what does that mean in practice? And I've talked about creating a framework, and I want to explain how that could work. So if you use my example of considering the health of an employee as opposed to the benefits you buy. So if we start with an employee who's fit and healthy and wants to remain so or become healthier, those employees will be looking to the employer for services that you could group together as preventative care. So consider things like yoga, in-house counselors, fresh fruit in the office, cycle to work, gym membership, healthy food discounts, money advice guidance. All of those things you can group together as people looking for preventative assistance. You then have employees who are worried something's wrong, or worried something may be wrong, or know that something's wrong and they want guidance. And these could be grouped together as needing diagnostic support. So here you're talking about health assessments, private GP, virtual GP, someone needing financial advice. And then you have the next tranche of people who know what the problem is, probably because they've been through the diagnostic support area, and they're actually receiving treatment. We group those as in treatment. And these are usually provided by your private medical insurance or possibly your income protection. So we now have a concept of reviewing services we offer staff aligned to the health of the staff, as opposed to presenting the policies we've bought and then asking staff to go and find out the bits that are useful to them, that might be useful to them. We can then focus on the mental, physical, and financial well-being, which has become much more familiar. And the way we help companies understand this approach is using a matrix with the health of the employee on the top columns and then the mental, physical, and financial in rows. What I wanted to do here is just give you a practical example of how we see that working in supporting our clients. So I've populated a few boxes to show you what I mean. So if you look at the preventative care, we have within mental health, we now have a box which is mental health and preventative care, and I've populated a couple of areas there which are sleep support, which could be provided by PMI. It could also be a standalone provider. You might have a CBT app. Again, it could be your private medical insurance. It could be your group income protection. You might have an in-house counselor who is provided by your employer. And if you go down the preventative care area, you could in the physical area, fresh fruit, gym discount, cycle to work. What you're starting to do is see a structure where you have identified all of the things that you could potentially offer via the policies you bought and via the standalone initiatives you offer, and you put it into a framework which you and the employee hopefully would be able to make more sense of than just a series of policies and initiatives. So while you're, and interestingly here, the private medical insurance policies have changed so much that lots of companies are offering different things in addition to the treatment, which is primarily around well-being. So while you're buying one PMI policy, you're populating multiple areas of your well-being strategy because you've selected that private medical insurance policy as opposed to another. Now, the real difficulty in selecting the provider without having a strategy behind the selection is that you might be accepting what the provider thinks is useful, as opposed to selecting a provider because they offer you a suite of benefits that complement your requirements. So you might have declined another provider who's marginally more expensive, but had a suite of wellbeing benefits that were far better aligned to your strategy. And in my experience of working in this sector for many years, premium isn't the driving factor. But without a framework to evaluate a product, it's very hard to judge one against another. So if I were to take it to the nth degree and assume that two PMI providers had equal medical insurance capabilities, but one focused on mental. So you're now thinking about the policy benefits aligned to your wellbeing strategy, as opposed to the policy benefits as aligned to premium or each other. Most companies that we surveyed are worried about their mental health in the preventative phase. So if you're looking at the matrix, you can quickly zero in on services you have access to. You can identify if you need more and critically promote those to your staff to maximize engagement. So we have, for example, Vitality is a good example of a company that offers a wide range of wellbeing things, but some of those things may be useful to a company and some might not. So they offer discounts on cost of coffee. Whether that's something that you'd want to promote or not, I'm not sure. But that's a well-being as part of their policy. But they also offer excellent sort of online yoga courses. Well, that would form part of your physical and mental preventative care. And so you might want to give that a higher priority than coffee discounts or cinema discounts, all of which are available. And we've been through the provider offerings, and including the standalone initiatives that we see companies offer. We've identified around 100 initiatives that could form part of a wellbeing strategy and could populate these boxes. I've listed only a few here, but it demonstrates the sheer complexity and overwhelming nature of the project if you don't have a strategy and a framework within which to analyze these things and then establish what's important to you. And you also shouldn't forget that in practice, somebody could easily be at different stages of health in each of their mental, physical, and financial, and the interaction of those is critical. And it makes it important, again, to have a clear strategy considering everything that you offer.
Really interesting stuff, Robbie, and looking at things from a very different perspective, which is always good. So obviously, lots of concepts, lots of lines of benefits. In terms of practical next steps, what would you recommend an asset manager does in order to start building their own strategy?
Yeah, I think firstly, you need to acknowledge that it's a work in progress, and it always will be. You go into this process expecting to draw up a framework, which is the first thing. If you can start there, it becomes much simpler. And then you need to look at the initiatives and communications that will all fit in, knowing that things will definitely change. If you were to have started this project 2 years ago and then COVID hit, you can imagine the changes that would have had to have been made in order to make this continually relevant. But at least you would have had a framework around which to make those changes. And most companies we work for sort of started from scratch when COVID hit, which was much more complicated. If you agree that the matrix I've outlined would be a good place to start, and there are lots of other ways of doing it, but this seems to be resonating well, then it does give you a simple structure to follow. And the way I can sort of summarize how that process would work is you start by agreeing the framework, like the matrix or a different one. Then you've got to review what you've got, either via insured products or standalone initiatives. We see a lot of companies that have used standalone initiatives once or twice because it felt like a good idea, but they haven't, because it wasn't part of an overall strategy. They either haven't persisted with them, or they haven't really understood how to judge their effectiveness. So, what have you got? What are you using? And are you happy you're getting maximum value out of them? Then you need to agree your priorities. What is it you're most worried about? Is it mental health in preventative phase? Is it treatment of people? Is it long-term absence? What is it that you're most concerned about as a business? And then you have to review what you have versus your priorities. And there may be some gap filling required if you feel like actually we just don't have the coverage we require in certain areas. Then you need to look at a communications plan. That's critical to the success of the project, really. If people don't know you can help them, then you may as well not offer the policy. So if the communication is really crucial. And do you have an intranet? Do you have a benefits portal? Do you want to use emails, animations, text messages, CEO messages? It's really important to understand how you're going to communicate and how often, and have a clear plan as to when we're going to do these things. And then it's about a formal launch, and we would recommend explaining to staff what you're doing and why you're doing it, and then present to staff. And then we need to monitor progress and the success. What works, what hasn't worked, and then review and amend. And I said earlier, this is a work in progress, and it always will be, and it always should be. So you do need to continually look at it and say, well, what's actually working for our staff now, and are there improvements we can make? I think for asset management companies, the good news is it doesn't cost much money to do this. The chances are high that you already buy all the insurance policies, which will be 90–95% of the required spend on wellbeing. But it does mean dedicating a bit of time to agreeing the process and implementing the communications on a regular basis to staff. And as I said earlier, most of my clients don't have huge HR departments and wellbeing dedicated staff. So the chances are you'll probably need external support to get to that place, but getting to that place shouldn't be all that difficult. So I think as a summary from my perspective, it's whether you're looking at a case of policy maximization or more formal wellbeing, we think most of the sector is on the right path in terms of the products they need and their intentions towards their staff. I've always found companies that I work for really want to help their staff, but a lot of them need a little bit of help ensuring that they understand what wellbeing could mean for the business, and then how to effectively deploy the strategy.
Thanks so much, Robbie. Really helpful, and we'll probably come back to you with some questions towards the end. I'd just like to change the flow now, if I may, slightly. I mentioned that we'd run a poll, and you should see it popping up on your screens very shortly. If you could just take a couple of moments to have a look at that and provide your answer, that would be really helpful. Whether we're going to share the results at the end or going to do it now, give everyone a few more seconds just to vote. So the result is that 100% of asset managers on attending the webinar don't have a strategy, but are planning to implement one within the next 12 months, which I think ties in very nicely with the results from Howden's survey. So yeah, hopefully we can revisit that in terms of practical next steps towards the end. I'd now like to turn our attention to financial well-being, an element of overall well-being that has risen in prominence recently. I'd like to introduce Richard Turner from Hargreaves Lansdown to the panelists, as a panelist. Morning, Richard.
Morning, Ian.
Morning. If I can just sort of start off this second session, can you define financial well-being for us and explain how you've seen it develop as part of a wider well-being strategy over the last year or two?
Yeah, absolutely. And so financial well-being is all about helping people feel more confident about making decisions with their money. Of course, if you feel in control of your finances, then your feeling of well-being will naturally improve as well. I'm sure we can all think of times when we've laid awake at night worrying about your mortgage, your credit card bill, redundancy, ill health, maybe even your pension. So while Hargreaves Lansdown has been delivering tailored financial wellbeing programs to employees for many years, more recently, the feedback that we've been getting is that the pandemic has actually made both employers and employees feel more vulnerable. Employers have seen firsthand how fragile the balance is for employees between feeling happy or not at work. And of course, money, or the lack of it, has been a huge factor in how people are feeling. So anyone who's taken a drop in income because of furlough or other reasons will have been put under enormous financial stress. And consequently, we've been working a lot with clients about building financial resilience for the future. Now, if we think back to the beginning of the pandemic, employers were in crisis mode. They were worried about the future of their businesses and, of course, the welfare of their employees. And the first priority was supporting the mental well-being of employees, as Robbie said earlier. Also, the impact of working from home, and for some employees, the isolation employees were experiencing. So employers were also keen to help support the physical and social side of well-being for employees. Things like home yoga, cycling, team games. I even heard of one law firm employing a Buddhist monk. And to be honest, Ian, that's where a lot of well-being programs have reached. Few have embraced financial well-being properly, and it's such an essential part of the well-being jigsaw, and it's certainly the logical next step. As Robbie said earlier, it's better to support and educate early than having to deal with the consequences later, which could include stress, absence, or even sadly the death of employees.
Thanks, Richard. So moving on slightly, what kind of financial wellbeing topics would you suggest need to be included in a wider program?
Yeah, it's a really good question. And financial wellbeing is of course not about getting your pension provider in once a year and having the same handful of employees turn up. It is about consulting with your employees and asking them what they actually want help with. Now, we're tweaking our selection of topics all of the time, but broadly, we can look at it in 4 broad areas. So first of all, if you think about the basic financial education that employees need, and through the pandemic, budgeting and debt management was very much in demand, but that can be applicable to any employer, any life stage, at any time. Also, building financial resilience has been a very strong theme, and it's not just about putting an emergency fund in place. It's much more than that. Also, scam awareness, with much higher occurrences of people being relieved of their money through scammers. And again, that's a very stressful experience to have to go through. So start with financial education, then move on to a module all about investing. So very few people actually know that their pension is invested in the stock market. So we've got to go back to real basics with some employees. I'm sure that doesn't happen in the asset management sector, but you never know. You can never make assumptions. Also, there's been a lot of volatility in the markets recently. So what's that about, and how can you cope with that? And a really strong theme at the moment is ESG, or environmental, social and governance issues around investing. And if you can help employees invest in line with their own beliefs, then you can start getting people really interested in their pensions and other investments as well. So once we've covered the basics and the guide to investment, then we can actually drill down into specific objectives for employees, and we can help them identify what's really relevant at their life stage. So it might be going back to pension basics. If you started a family, you might want to start a tax-free savings plan for them through a child's ISA, or indeed a lifetime ISA if you wanted to start saving for a house deposit. So we can actually get people thinking about specific objectives. And then there's a certain stage in life where you do get very interested in pensions, whether you like it or not. So from age 50, we're really proactive about contacting people in that last sort of decade or so of their career. So that's all about maximising pension allowances, maximising other allowances like ISAs. Might be beneficial to bring all of your pensions together in one place where you can see them all and manage them better. And nowadays, there's a lot of responsibility put on the employee about how they take the money at retirement. So about explaining retirement options as well. So as I say, tweaking it all the time. but hopefully, there's meaningful moments to people through their life stages, and what we try to do is tailor that to our clients' needs.
Thanks, Richard. So I guess there must be some topics that are particularly financial wellbeing topics that are particularly in demand at the moment. Can you highlight any of those for us?
Yeah, absolutely. And I think it's largely been driven by the individual situation of the employees. So very broadly, if you've got less money as a consequence of COVID, we've seen a higher demand for help with topics like budgeting and debt management, like I said just now, and help to build financial resilience. Now, that includes putting an emergency fund in place, but it also means thinking about what's in place if you got seriously ill or passed away. What are the consequences to your family? And that's where our work overlaps with Robbie's very much. We also think it's really important not only to define financial wellness, but also to provide a plan to help employees achieve their own financial well-being. So we're about to launch what we're calling our 5 to Thrive initiative. So that actually breaks down into 5 areas. So first of all, we think people should control their debt. We think people should protect their family. Also think that saving for a rainy day is a high priority, planning for later life, and also investing to make more of your money. So the 5 to Thrive principles will take the framework for what we're seeing as a new savings and resilience barometer, which we're going to be launching in January 2022. And that's going to enable us to publish a biannual tracker of the nation's progress on financial resilience. And we'll be able to measure progress by geographical location, age, and household income, which I think will actually be a fascinating insight into the nation's finances.
Absolutely, Richard. I'm sure it will. The question that occurs to me, one of the obvious ones: what has COVID done in terms of focusing people's attention in financial wellbeing? Has that brought in itself some interesting dynamics?
Yeah, and there's been some topics which are more popular. And of course, there are employees who've ended up with what's been referred to as accidental savings. That's the extra money you've got because you've got the same salary, but you're not paying the season ticket or the meals out or the holidays. And as a consequence, some topics are now more popular. For example, Hargreaves Lansdown has seen a massive surge in the number of people taking out new ISA accounts. And of course, that's led to more interest in starting investing, maybe saving for a house deposit, savings for kids, and getting valuable tax relief by topping up pensions as well. So it'll be interesting to see how the hybrid model and the gradual move back to offices affects employees' finances. We've actually been asked to run some sessions on that issue alone in coming months. But another very current topic is ESG, as I mentioned just now, and that's helping employees invest in line with their own beliefs, whether that's around climate change, social issues, or the way businesses govern themselves. Many pension default funds are now aligned with ESG principles, so it's a great way of getting employees engaged with their long-term retirement fund as well.
Thank you very much. So bringing it all together, how would financial well-being complement and work with the broader benefit strategy that Robbie articulated earlier on?
Well, I think it's very much linked, and there's some obvious areas where we overlap, like stress and sleep deprivation, like Robbie mentioned earlier on. If we think about money worries being the biggest cause of stress, by the time an employee calls the EAP line or takes some drastic or even fatal action, frankly, it's too late. But if we can coach, teach, guide, support employees to make smarter financial decisions years earlier, hopefully they'll never need to make a claim on the company insurances. And that aligns with Robbie's approach of being proactive and working preventatively earlier on, rather than having to deal with the consequences. In my experience of dealing with asset management firms, though, you can never assume that because you generally employ well-educated and high-earning individuals, that they're actually any good at managing their own money. Some of the highest earners I've met are also some of the biggest spenders, the biggest borrowers, and biggest risk takers, which can mean that their financial situations can really quickly get out of hand. You also need to think about catering for everyone in the firm, whether they are an investment professional, it could be an IT, marketing, HR, support, or whatever. and actually think about tailoring financial well-being to what your employees actually need at their life stage. So for example, thinking about financial resilience again, our financial well-being specialists can raise awareness of the employer's risk benefits when they're running the financial resilience sessions, which can really help raise employee engagement and appreciation of the company's risk benefits, like death in service, PHI, private medical, which is what Robbie's providing. I can't stress enough, though, that the really important part of the process is to identify what employees ask. So just ask them. There's no point churning out a program of topics hoping that employees will take interest and log on. So really, to summarize, like Robbie, we're proactive. We help conduct employee surveys. We identify employees at different life stages, and actually asking them what they need help with. That can help us deliver tailored content that's really relevant and meaningful to them.
Excellent. Thank you, Richard and Robbie both. That brings us to the end of the formal presentation. We've got about 5 minutes, just under 5 minutes left, and we've got some questions, which I'd like to put. The first one, I'll keep you on, Richard, as your larynx is working well. In terms of a financial wellbeing program, how long would it take to actually set one up? What are the component parts of that?
Yeah, good question. I think just going back to what I just said, a lot about is research and surveying employees. So by the time you've done that, got the communications ready, identified a good time to launch it, probably 2 or 3 months is adequate.
Okay, excellent. And I suppose the $64,000 question: what does it cost?
It's a very good question, and I think sometimes when you think about these type of programs, you can probably think it's really expensive, and indeed sometimes the cost can run away with it with lots of add-ons. We've tried to make things really transparent with our financial wellbeing packages, so we basically have fixed prices, and that can range anything from £3,000 for a 5-day program, which lends itself quite nicely to a financial wellbeing week, up to something like a 10-day program, which is about 13,500, and that's for bigger firms where you might want to make a really big splash around maybe a benefits roadshow or a flex renewal, or maybe holding a financial wellbeing month, or even spreading it over longer than that. But yeah, it can be reasonably well priced if you're spreading it across a lot of employees.
Great, thank you, Richard. And Robbie, one for you, if I may. You mentioned earlier that communications are particularly important in the context of a wellbeing strategy. How would you actually go about, constructing that communication plan? What are the essential elements?
I think it's having a plan to start off with, so you'd normally divide the communications amongst the areas that you want to target. So even if you said if it was as little as 1 email a month, and this month we're doing preventative care and mental health, and next month we're doing financial, next month we're doing physical, you could look at it and be that simplistic about it, but it's being regular, consistent, giving coherent messages about what you offer and how they can access things. And I think having a plan in advance is really the key, because otherwise you end up doing things ad hoc and you can't really measure whether they're working or not. And if you just do things ad hoc, it's not forming part of any sort of strategy. So, firstly, make sure you have a plan. Secondly, what are the mediums by which you're going to deliver the message? So it might just be email, it might be intranet, you might have an online platform that you use. You could have animations, you could have presentations to the staff. But the real key is sit down and map out your 12-month plan, and then follow that in line with your strategy, rather than ad hoc things when you happen to be doing to feel like they're relevant.
Excellent. Okay, and one more question, final one for you, if I may. You mentioned Vitality earlier as a provider that has potentially really attractive, embedded wellbeing provisions, but in terms of PMI providers, can you just share with us some of them that do offer wellbeing services?
Yeah, Vitality is sort of good headline, and they market themselves really well. You then look at companies like Cigna who do it completely differently. So they might offer you a wellbeing fund that the employee can then direct their wellbeing care as they wish, which is a completely different but also very interesting way of looking at it. Then you've got the Boopers and the Axes of the world where they do actually offer a lot of wellbeing stuff, but they don't market themselves in that sector as well as the likes of Vitality. I think that's one of the real key points of what I was talking about earlier, is the care given by these companies in terms of payment for care is pretty good across the board, but they're all taking different approaches to well-being. And probably offer them the bulk of their well-being services.
Excellent, thank you. So that brings us to the end of the Q&A session and the formal presentation. I'd just like to thank both of our panelists, Richard Turner from Hargreaves Lansdown and Robbie Weston from Howden, for their valuable contributions. Interestingly, the results of the poll do suggest that everyone's on the early stages of a journey towards creating a strategy. So we hope that we've confirmed this morning that there is a structured way to go about that. And if you're already moving in the right direction, that's an excellent first step. Obviously, it would be great to strike up a specific conversation with you outside of this webinar environment. So we'll be in touch afterwards, not least to share the survey results and give you a little bit more copy that will help with that decision making. So thank you very much for your participation and attendance this morning. Enjoy the remainder of the day and your weekend. Thank you very much and goodbye.